So the Apple Hearing Study is a multi-year study where we're evaluating sound exposures that people get from their environment if they have an Apple Watch, or through their headphones if they're using an iPhone. As the COVID-19 pandemic began, we realized that we had an opportunity to see what the impacts were on people's sound exposure. We zoomed in on 4 different states: California, Texas, New York, and Florida, and looked at how sound levels change as each of those states started to implement these interventions and ultimately went into lockdown. And what we saw was drops in personal noise exposures from environmental noise. So across about 516,000 days of measurement, we saw on average about a 3 decibel drop in individual exposures before and after lockdowns were put into place. Now, you might think 3 decibels, well, who cares? That doesn't sound like very much. But it turns out 3 decibels is actually a halving of how much intensity of sound you're being exposed to. So that's, in fact, a huge reduction. And we know that reductions of that size have corresponding health benefits. Noise exposure, while it certainly can cause hearing loss, has also been linked to high blood pressure, to heart attacks, and to stroke. I want to emphasize that the data that we've looked at here, so 516,000 daily measurements of noise, is unprecedented. There has never been another study that's collected anywhere close to that amount of data.